Hello students, in the continuation of part 1 of the ligaments of knee joint, today we will discuss the part 2 of the ligaments of knee joint. In the part 1, I already told you about the fibrous capsule, ligamentum patelli, oblique and arcuate popliteal ligament and coronary ligaments. Now in today's session, we will discuss the medial and lateral collateral and anterior and posterior cruciate ligaments. So let's discuss the collateral ligaments first. Now, when you are talking about the collateral ligaments, these ligaments are present on the medial and lateral aspect of your knee joint. So, they basically provide the strengthening to your joint on both medial and lateral side. Now, one ligament is known as tibial collateral, which is present on the medial side, and one ligament is known as fibular collateral, which is also known as lateral collateral ligament. So, when you will have the tibial collateral ligament, the first question which is very commonly asked in your viva, that what it represent actually. So morphologically, the tibial collateral ligament represent the lower part of the tendon of ischial fibers of adductor magnus. Now this is an important question to understand, that whenever we are talking about hamstring group of muscle, you know that hamstring group is actually the muscles which are present in the posterior compartment of your thigh. So when you will see the posterior compartment muscle, you have one of the criteria of the hamstring, that they should insert one of the bone of the leg. You have the two leg bone, fibula and tibia, and your hamstring has to reach either to the tibia and fibula if they are completing the criteria of hamstring. So here you have to understand that ischial fibers of adductor magnus, also known as hamstring group, they are part of hamstring muscles. So they has to enter into the leg and they should insert on the your tibia or fibula. But we know that when you will have the actual insertion of your adductor magnus, you know that this is the lowermost attachment of the fibers of adductor magnus, that is on the adductor tubercle. Then how it is completing the criteria that it is inserting in one of the leg bone? For that you have the tibial collateral ligament, and this tibial collateral ligament is actually representing its actual attachment on the leg bone, that is your tibia. So in this way, now you can see that adductor magnus arises from the hip bone and it is inserting on the tibia. But though the original insertion ends at the adductor tubercle, and this connection from adductor tubercle to the tibia is morphologically represent the fibers of the ischial part of adductor magnus, and it represents the tibial collateral ligament. Clear? So the tibial collateral ligament is a very important question for your exam, that it morphologically represent which part of the muscle. Answer is, it is a lower fibers of the ischial part of your adductor magnus. Now here in this video clip, you can see that when you will see the adductor magnus, it is a very broad muscle which is a medial compartment muscle. And when you will see the origin, now this origin is basically coming from this conjoint ischiopubic rami, and when you will reach to the ischial tuberosity, you can see that these fibers are arising from the ischial tuberosity, and these fibers are actually considered as a part of your hamstring group. The remaining muscle fibers are the part of your medial compartment of thigh. Now when you will check the insertion of your adductor magnus, the lowermost fibers which are inserting here are the ischial fibers which are coming from the ischial tuberosity. The remaining fibers are inserting on the linea alba, and this is the largest hiatus through which your femoral artery convert into the popliteal artery. Below this hiatus, these fibers are the ischial fibers which are the part of your hamstring group, and these fibers have the lowermost attachment on the adductor tubercle. But again I am saying that to complete the criteria that the hamstring has to attach on the one of the leg bone, that's why we are seeing that this tibial collateral ligament crosses the knee joint medially and it will attach on the upper part of tibia. Now when you will see the attachment of this tibial collateral ligament itself, superiorly it is attached to the medial epicondyle of the femur, that is a bony part of the femur just adjacent to the adductor tubercle. So here you can see that this is the medial side. Now this is your adductor tubercle, which is receiving the lowermost end of the ischial fibers of your adductor magnus. Now adjacent to that there is a medial epicondyle. Now from this medial epicondyle you is having a connection which is going downwards to the tibia. Now the tibial collateral ligament, when you will trace, divides into the two parts. One is the superficial head and another is the deep head. So in this way you will find that this ligament is having the two parts. This is superficial and this is the deep part of your tibial collateral ligament. Now first we will discuss about the superficial part of tibial collateral ligament. Now the superficial part is longer and it extends downward as a flat band. So now when you will see this image, now here you can see that this is the fibula, here is the tibia. So on that side you will have this medial collateral ligament. Now this medial collateral ligament is starting from this medial epicondyle. Now this is our superficial part and you can see that this superficial part is longer and this is the deep part, which is as compared to that is shorter in the size. Now the second thing is that this superficial part is having lower attachment on the tibia and it attached to the medial condyle and upper part of the medial border of the shaft of tibia. So you know that here you will have the medial border and it will attach here to the upper part of the shaft of the medial border of the tibia. So this is the one thing about the attachment of the superficial part. Then you will have the lower part of this ligament. Now this is the important thing is that when you are doing the dissection, this lower attachment of your superficial part is not visible. Why? Because here you can see these are the three tendons which are actually lies superficial to this lower attachment, and these tendons you know that they are forming the gyrops, and these are sartorius, gracilis and semitendinosus. So this is the important question for your exam, that lower part of the ligament crossed superficially by the three tendons of sartorius, gracilis and semitendinosus. That means when you are doing dissection and if you want to see the lower attachment of the superficial part of tibial collateral, it is not visible because that is hidden by these three muscles insertion. So that is the one thing. Second thing is that it covers the inferior medial genicular vessels and nerve. That means you will go deep to this superficial part. Here you will find three structures. Now what these are? These are medial. These are the structure which are on the medial side of the knee joint in inferior aspect of the knee joint. So these are inferior medial genicular nerve and vessels. Clear? So they are inferior medial genicular nerve and vessels which lies deep to the superficial part. So which structure lies superficial to the superficial part? Three tendons. And which structure lies deep to the superficial part? Answer is inferior medial genicular nerve and vessels. Now in this video clip, if you will see, what you are able to understand that there are three muscles of the three different compartments. The anterior compartment you have sartorius, from medial compartment you will have the gracilis, from posterior compartment you will have semitendinosus. All these three muscles which are coming from the three different compartments are actually concentrating at one point, that is your medial side of the upper part of tibia. Now here you will realize that these are known as gyrops, and you can see that this lower part of the tibial collateral ligament is not visible completely because these three tendons are lies superficial to this ligament. So once you will remove all these three tendons, then and then only we are able to see this attachment of your tibial collateral ligament. So this is the upper part of the medial surface of the tibia, which is having the uppermost attachment of the superficial part of your tibial collateral, which is having superficially the insertion of three more tendons. Clear? Now we'll talk about the deep part of tibial collateral ligament. Now my dear students, now this diagram is having a very important finding here. Now when you will see the deep part, now where is the deep part? Now this is the deep part of your ligament. Now when you are drawing this deep part, you can see that just inside this deep part you are having this one more line. Now this line which is visible here is your capsule. Now this is the capsule, and here what you are able to understand that this capsule is having a very close relation, or you can say that the inner side of this deep part of tibial collateral ligament adherent to this capsule. But on this opposite side, if you are able to understand, you will realize that this is your fibular collateral ligament, and you have to draw the capsule here, and there is no connection between the capsule and the lateral collateral ligament. So this is a very important thing to understand when you are drawing these two ligaments in relation to the capsule, that on the medial side, the deep part of the tibial collateral ligament closely related with the capsule, but on the lateral side, this fibular collateral ligament is not adherent to this capsule. Clear? So this is the one thing. Second thing is that when you will see the deep part is shorter, it is triangular, and because you will find that it is triangular, the base of this triangle is attached to the medial condyle of tibia along the upper margin of the groove for semimembranosus. So you know that semimembranosus insert in the posteromedial aspect of the tibial condyle, and along that groove you will have the deeper arrangement or attachment of your deep part of tibial collateral ligament. And this deep part blend with the capsule of the knee joint, and it's a very commonly asked question in your exam that what is the difference between the fibular and tibial collateral ligament. So this is one of the difference, that the capsule is having close relation with the tibial collateral ligament. And because of this reason, you will find that there is a indirectly you have the connection of medial meniscus, because medial meniscus is closely adherent to the capsule, and capsule is closely adherent to the deep part of tibial collateral ligament. So now the question comes is that which structure lies in the interval between the superficial part and deep part of tibial collateral ligament. So I told you one of the content, that is the inferior medial genicular nerve and vessels. So these inferior medial genicular nerve and vessels lies deep to the superficial part. Apart from that, you will find the terminal part of the semimembranosus muscle, because the semimembranosus will go and insert to its groove on the posteromedial aspect of the medial condyle, where you will have this attachment of your deep part of tibial collateral ligament. Clear? So this is again a question for your exam. Structure lies between the superficial and deep part of tibial collateral ligament. Now in this video you have to understand that how this inferior medial genicular artery lies deep. So here you can see that this is the lateral side. Here you can see lateral genicular arteries. This is the superior and inferior lateral genicular artery. This is the popliteal artery which is giving the branches. You can see these are the medial genicular arteries, and you have the middle genicular artery. The middle genicular artery will go inside the knee joint after piercing the posterior part of the capsule. Now here on the medial side you can see that this is the deep part of your tibial collateral ligament, and superficial to this deep part you are having this inferior genicular artery. What is that? Inferior genicular artery, and on this you will have the another layer of the superficial part of your tibial collateral ligament. Clear? So when you will draw the superficial part of your ligament, now it will come here like this. So this artery is now comes in between the deep part and the superficial part. Clear? So this is an important thing to understand, that which structure lies between the superficial and deep part of the tibial collateral ligament. Your answer is inferior medial genicular artery and nerve. Now we'll move to the lateral collateral ligament or fibular collateral ligament. Now students, you have to keep this thing in mind. When we are talking about the fibular collateral, we are talking about the lateral aspect of the joint. So it extends as a fibrous cord downward and backward direction from the lateral epicondyle. Clear? The earlier was from the medial epicondyle. It is from the lateral epicondyle of the femur to the head of fibula close to its styloid process. Clear? So here you can see that this is your fibula, And here you can see this is your fibular or the lateral collateral ligament. It is not having the superficial and deep lamina. It starts from this lateral epicondyle of the femur. It is going downward and it will go on the posterior aspect of this styloid process of your fibula. Now, it is overlapped superficially by the tendon of biceps femoris. So, this is again an important thing to understand. On the medial side, we have seen that this lower end of the superficial part is overlaid by the 3 tendons, but here on the lateral side, this lower end of the fibular collateral is overlaid by the biceps femoris. The deepest surface of the ligament is not adherent. Now, this is again a question which I told you that when you are drawing this ligament, you can see that this is your capsule. And this capsule is not at all having any connection. There is a clear-cut space is visible. It is not adherent to your fibular collateral ligament. So, the gap between them is occupied by the tendon of popliteus and inferior lateral genicular vessels and nerve. What do you mean? That when we are talking about the medial and lateral side, you have to understand that there are medial and lateral inferior genicular nerve and vessels, and these nerve and vessels are related with the adjacent site of collateral ligaments. Now, on the lateral side, you are having one more important structure, and that is the tendon of popliteus, that I will explain you in the coming video clip. Now, there is one more important question here, that this ligament morphologically represent the primitive origin of peroneus longus. Now see, this is a origin, and I told you that the tibial collateral ligament represent the morphologically the primitive insertion. Clear? So this is the difference, that this ligament is showing that your peroneus longus arises from this point, but if you will see the tibial collateral ligament, it says that it is actually the insertion of adductor magnus here. So this is the difference, that this ligament represent the primitive origin of peroneus longus, while the tibial collateral represent the morphologically primitive insertion of your adductor magnus. So now in this video clip, what you are able to understand, that this is your long tendon of biceps femoris, which is going downwards, and here you can see that this is the upper part of the fibula. Now, when you will remove your biceps femoris, now you can see this is a ligament is known as fibular collateral ligament. So, I told you that the fibular collateral ligament in attachment is overlaid by the biceps femoris. Now, deep to this ligament, you can see there is a oblique tendon. Now, this oblique tendon is your popliteus. You know that popliteus arises inside the capsule of your knee joint. So, this tendon of your popliteus lies deep to your fibular or lateral collateral ligament. Apart from that, here you can see deep to this fibular collateral, you are having this inferior lateral genicular artery along with your nerve. Clear? So, dear students, now you have this image in your mind that when we are drawing medial and lateral fibular collateral ligament, on the medial side, this is your deep lamina and this is superficial lamina. In between them, you have to draw the two sets. One is the inferior medial genicular vessels and your semimembranosus. Lower part of the superficial tendon is, superficial ligament is covered by the 3 tendons of sartorius, gracilis and semitendinosus. On the lateral side, when you will see this attachment of the fibular collateral is overlaid by the biceps femoris. Deep to this, you will have the lateral inferior genicular nerve and vessels. Apart from that, the important thing is that there is a close adherence of this capsule with the deep part, where you don't have the any adherence on the lateral side. Now, what are the differences? You should have this list in your mind whenever you are writing the short note on the tibial and fibular collateral. So, the first thing which I already told you, that tibial collateral morphologically represent the degenerated tendon, which actually represent the insertion of the ischial fibers of your adductor magnus on one of the leg bone to complete the criteria of hamstring. Here you will find that the lateral collateral morphologically represent the origin of your peroneus longus. The second important thing is that its deep surface is not adherent to the fibrous capsule, while when you will see the tibial collateral ligament, its deep part is having the strong relation with your capsule. The another important thing is that this fibular collateral will not divide into the superficial and deep lamina, while the tibial collateral divide into the superficial lamina and deep lamina. Then you will have the deep part of the ligament, which deep part is having a indirect connection with the medial menisci also. Here you don't have the fibular collateral ligament connection with your lateral menisci. Apart from that, you have to keep in mind that its lower part is overlaid by the biceps femoris, while the lower part of the superficial lamina of tibial collateral is overlaid by the three tendons of sartorius, gracilis and semitendinosus. Now we'll move to the cruciate ligaments. Now as you will open the knee joint capsule and enter inside, you will find two X or cross shaped ligaments, and they are known as anterior and posterior cruciate ligaments. So these anterior and posterior cruciate ligaments are present inside the knee joint, inside the capsule, so they are intracapsular, but they are extrasynovial. So what is the meaning of this word extrasynovial? The meaning of extrasynovial is that when you will see the synovial cavity of your knee joint, they are not floating inside the synovial fluid. So that for that you can see this video clip. Here you can see that this is your capsule of knee joint. Now in this we can see that this is the anterior deficiency of the capsule, which I already explained my first part of the knee joint, and this is the posterior deficiency in the capsule. Now if you will remove this capsule, what you will find inside is that there is a lining of synovial membrane. So now you can see that this is the synovial membrane, and if you will rotate this joint from all the side, you can find that this is your femur. You can see that this is the extension of synovial membrane in suprapatellar bursa, and now it is all about your synovial cavity once you will remove the femur. Now after removing the femur, still you can see that this synovial cavity is not having your ACL and PCL. These cruciate ligaments are outside the synovial cavity. You can see that this cavity is not having this green color area. Now this green part is your cruciate ligament, and you cannot see this green inside. Why? Because this synovial cavity is not having the ACL and PCL. The cruciate ligaments are very well visible completely from the posterior side of the joint, where you can see this is an extra synovial area. So this is an important thing to understand, that your anterior and posterior cruciate ligaments are not float into the synovial fluid. That means they are extra synovial. Now here you can see that this is a synovial cavity, and from the posterior side you can see this is your anterior cruciate ligament, and this cruciate ligament is not floating in the synovial fluid. So this is the meaning of the word that they are intracapsular. That means you have to remove the capsule of the knee joint to see, but they are extrasynovial. That means if you will approach the joint from the posterior side, you can see the ACL and PCL without damaging your synovial membrane, because they are not floating inside the cavity. Clear? They cross to each other like a X, and that's why they are known as cruciate. They are named as anterior and posterior cruciate on the basis of their attachment on tibia. Now this is again a very important concept to understand, that their tibial attachment decide their name. Now this is your tibial plateau, this is the superior surface of the tibia, and this is the posterior view of the bone. Now this is the posterior side of the intercondylar region of the tibia, and you can see this is the lower attachment of one of the ligament. This is the lower attachment of this another ligament. So this is the posterior side, so this is the posterior cruciate ligament, and that will be the anterior side, so this will be the anterior cruciate ligament. So the ligaments are named not on their femoral attachment, they are named on the basis of their tibial attachment. Clear? Both ligaments are taught at the extreme flexion and extension of the joint, that we will see in the coming slide. The cruciate ligaments are developed from the posterior part of the primitive intercondylar septum. What does it mean? That here you will have the femoral condyle, and these are the tibial condyle. So earlier there was a septum, and that septum is a vertical septum which divides these two cavities. But with the evolution, what will happen that the septum disappears and the two remnants of the septum persist inside the capsule, and these remnants are known as ACL and PCL. So now here you can see what are the attachment of the ACL and PCL on the tibia. So here you can see this is the tibial tuberosity. So this is the anterior aspect of the tibia. This is the intercondylar region of the tibia. These are the two condyles. This is the lateral condyle, medial condyle. Now in this intercondylar area, anteriorly you can see this is the attachment of the one ligament. Now this is known as anterior cruciate ligament, and now here you can see this is the attachment of one more ligament in the posterior part of this intercondylar region, which is known as posterior cruciate ligament. So here you can see that anterior cruciate and posterior cruciate names are given on the basis of their attachment on the intercondylar region of tibia, not femur. Now what is the femoral attachment? If you will see the femoral attachment is different. So here you can see this is a cross shape attachment. You can see this posterior view, and here this ligament, which is known as posterior cruciate ligament, is going forward direction, and you are able to see this ligament is coming posteriorly. So anterior cruciate ligament is having a backward direction, while posterior cruciate ligament is having a anterior direction. Clear? So this is the one and important concept which you have to understand here. And when you will see the another important concept, what you are able to see that this is your lateral side. So this is your lateral femoral condyle. This is a lateral femoral condyle. This is a medial femoral condyle. Now this lateral femoral condyle is having the lateral surface of the condyle and medial surface of the condyle. Now here what you are able to see is that your anterior cruciate ligament is attaching here. So what is this surface? This surface is the medial surface of lateral femoral condyle. So when you will see the anterior cruciate ligament, it arises from the anterior aspect of the tibia, that is intercondylar region. Then it is having a backward and lateral direction, and in this way it will attach on the medial surface of lateral condyle of your femur. Clear? So what is that? Medial surface of lateral condyle of femur. Clear? So this is the one thing. Second thing is that when you will see the attachment of your posterior cruciate ligament, it is in a reverse direction. So here if you will see these two attachments, now here you will find that this is the direction of your posterior cruciate ligament in forward, and you can see now this is the lower attachment of the ACL, which is going in the backward direction, and it will take the attachment on the medial surface of the lateral femoral condyle. Clear? So my dear students, the attachment of both is very important, and you have always keep this thing in mind that they will cross to each other in such a way that their names are given because they are having a different attachment on the tibia, anterior and posterior cruciate ligaments. So the anterior cruciate ligament attached below the anterior part of the intercondylar region of the tibia, which I just explained you, and then the question comes on its direction. So what is the direction? It is but obviously going in the upward direction, but it is going in backward and lateral. Clear? So what is the direction? It is taking origin from the anterior part, then it is going in upward direction. But when you will see the upward direction, it is going to attach on the medial surface of the lateral femoral condyle. So it is backward and laterally. Above attachment, where it is the above attachment, medial surface of the lateral femoral condyle. Now, when you will see the function of the knee joint, you will find that when you will do the extension, when there is a complete extension, this ACL or anterior cruciate ligament will become taut at the time of the extension of knee joint, and it prevents the posterior dislocation of the femur on tibia. Now here you will have the femur. So it is attaching here on the femur. Now this is the anterior aspect, this is the posterior aspect. So what will happen that when you are doing the full extension, it is preventing the femur to go more backward. So it is preventing the posterior displacement of your femur on the tibia. But simultaneously it is also preventing the anterior dislocation of tibia on the lower part of femur. That means this is the anterior dislocation of the tibia and this is the posterior dislocation of the femur. Both of these parts are prevented by this connection which is known as anterior cruciate ligament. So if the anterior cruciate ligament will get damaged, you can now move this tibia anteriorly, which is known as anterior drawer test. So why the anterior drawer test is positive? Why the tibia is become loose and you can pull the tibia forward? Because this ligament is get detached and this ligament is generally prevent the anterior displacement of the tibia and posterior displacement of the femur at the time of the extension. Clear? Now we'll talk about the posterior cruciate ligament. The posterior cruciate ligament, if you will see the lower attachment attached in the posterior part of your intercondylar area of the tibia, and it runs again in upward direction but not in backward, in forward direction. So this is a basically very important question for your exam and it will move medially. So this is the posterior cruciate ligament and it is also going in upward direction, but the direction is forward. ACL was going in the backward direction. It is going medially, ACL was going laterally. So what is the above attachment? It attached to the anterior part of the lateral surface of medial femoral condyle. So which surface it is attaching? On the lateral surface of medial condyle. Clear? So ACL attached on the lateral condyle, PCL attached on the medial condyle, ACL attached on the medial surface of lateral condyle, while the PCL attached on the lateral surface of medial condyle. Clear? So this is the important thing to understand and this is the question of your exam about their upper attachment. Clear? Because upper attachment is a little bit confusing. So you have to keep in mind that both the cruciate crosses to each other and this anterior cruciate will go laterally because it has to attach on the medial surface of lateral condyle, while this PCL goes medially because it has to attach on the lateral surface of medial condyle. Clear? So it is lateral and medial, it is medial and lateral. Now there is one more difference, that this ligament get taut during the flexion of the knee joint and it prevents the anterior dislocation of the femur on tibia and posterior dislocation of tibia on femur. That means if we will see that you have the tibia on this above, we have seen that what this ACL is doing, ACL is avoiding the anterior dislocation of the tibia, but PCL is avoiding posterior dislocation or posterior shifting of the tibia. Clear? So this is the important thing to understand, that PCL avoid posterior dislocation of the tibia while ACL avoid anterior dislocation of tibia. So now at the end of this session of your ligaments of knee joint, we are able to understand that the collaterals are there and cruciates are there. Collaterals are extracapsular, cruciates are intracapsular, and the collaterals supports the joint from right and left side, or you can say the medial and lateral side. One is known as tibial collateral, one is known as fibular collateral. The fibular collateral is actually represent the origin of your peroneus longus, while the tibial collateral represent the primitive insertion of the ischial fibers of adductor magnus. And then you will have the two cruciate. Both cruciates are extrasynovial, that means they are not floats inside the your synovial fluid. The second thing is that direction is different. The ACL is going backward direction while PCL is going in the forward direction. ACL get attached on the inner side of your lateral condyle while PCL get attached on the inner side of your medial condyle of femur. Clear? So this is about the session. Thank you.